Hi everyone, Dr. Scott Schreiber here with Minnesota Spine and Sport, and we're talking about arthritis today. So I've had patients come in and they say, "Oh, I had an X-ray and I have my knee or my discs or whatever. Everything's bone on bone." I keep on hearing that catchphrase, "bone on bone, bone on bone." Well, so then we're talking and everything, I'm looking at, and examining the joint in question, and it still moves. If it still moves, it's not bone on bone. If it's bone on bone, you won't be able to move it, and it's going to be excruciatingly painful. So just to throw that out there, I want to make sure that you guys understand that, like, when they you do have some wear and tear or decreased disc height or joint space, does not necessarily mean that everything's worn out and you're destined for a joint replacement, because that's far from the case. If it moves, we have a good shot of rehab in it, and there's different ways about doing that too. Big thing with arthritis is movement, lots of movement. We've got to make sure that you're exercising within your functional training range. And what we mean by functional training range is that area that does not provoke the pain. And it may be something as simple as walking out into the parking lot and back, or to your mailbox and back, and slowly building up from there. With that, we can address any muscle imbalances, any overactive or underactive muscles. Look at the joints themselves and make sure they're moving properly. And the joint itself can be a source of pain, so we got to look and make sure that's working right. Supplements wise, there's a ton of things you can take. What we have in the office currently is Arthrobin, which is an awesome product. The Arthrobin is a powder. Again, you take a loading dose twice a day in the morning and at night for 2 weeks initially. It has 3 ingredients. You have collagen peptides, which are 2 of them, and then an anti-inflammatory. Awesome product. This is a medical food, as you can see down here. What is nice about medical food is they've been researched, and it talks about where you can actually put the claims right on the labels, as opposed to dietary supplement, which we have the little blurb in the back. Where is it here that says not intended to do anything. But anyway, so you have Arthrobin's a great product for arthritis. The collagen peptides will actually build up the joint over time. It takes a while, so but that does happen. I have had most patients that do take this notice relief within a week. That's largely due to the anti-inflammatory component, but we'll then slowly build up that cartilage. Next supplement, Daxaprin, awesome product, great product for pain of all types, but really nice for relaxing the muscles around the joints if they're really tight and stiff. Then the last one is Curcumin Veil, great turmeric product. Again, great anti-inflammatory. What's nice about this product, 2 things. Again, we have a specific blend of curcuminoids, which is the extract that comes from the turmeric, which is really good for you, and the delivery system, this E-Veil delivery system, which is really good. Things are more absorbed that way, which is not found over the counter at all. So, great products, but again, the biggest thing is exercise and movement, evaluating the joint to make sure that there isn't any type of laxity in specific ligaments and things like that. But I would say 90% of the time that is the case. So feel free to move. You're not destined for the joint replacement or anything like that, but definitely check it out. And if you have any questions, by all means, please call me, get in here for an evaluation. We can check these things out and determine whether you need that referral to the orthopedic surgeon, or can we handle this conservatively. So if you have any questions, you know where I'm at. Thanks. Bye.